Hello everyone. Today I'm going to speak about how COVID vaccine was ineffective during a COVID SARS and what could be the better alternative for the pandemic. I am a postdoc working in soft condensed matter physics. My research has brought us in these areas, but today I'm not going to discuss about those things because I found that uh, in this area, in this research area, especially COVID and like epidemiology or maybe the medical science, data is more appreciated than any physical processes or any explanation of scientific hypothesis or how things could go wrong or things like that. So take those my studies as a perspective or things that brought me here, but the total presentation will be self independent in a sense that I'm talking about the data here. Okay, let's move on. So I would draw your attention to this plot. I think this is very important to understand this plot, and then it will be helpful to move forward. So this data I collected from Israel. I selected Israel because uh, relatively Israel is a small country, and mainly all my talk here is, or maybe my attention in the COVID pandemic is due to the weather effect that arise from some other phenomena that I'm not going to discuss here. But what the point I'm making here is that the Israel, because Israel is a little bit is a comparatively small country, so weather effect is comparatively similar to all parts of it, and also its health system is very unified, and they collected data very meticulously. So that's why I think this data is very good to see what's going on here. Now you see here the green plot, green curve shows the vaccine doses percentage for the people who received one dose. The zero represents the date December 12, 2020, and all those numbers in the x-axis represent the week from the first dose of the vaccine, and the blue curve represents the case percentage among the vaccinated people. So the green curve represents the percentage of people are vaccinated in Israel. The blue curve represents percentage of positive COVID cases who are vaccinated among all those cases. So when these two curve matches perfectly, that means the vaccine has no effect at all. If the blue curve goes upward or above the green curve, then means vaccine has negative effect. If blue curve goes downward, then the green curve, the vaccine has positive effect. So I this is kind of, I didn't do any kind of adjustment, and I understand that age is matters here. That's why I stratified the data by age, uh, age section, like 80 to 89 years, 70 to 79 years, and so on. So I tried to make the data as accurate as possible. And you can see here, so this is the first week after the vaccination, and this is the second week, and so on. So this data represents week. So first 2 weeks basically was the first dose, and if you observe all the age, mostly you see that the first dose vaccinated people actually got more sick. I mean, the vaccinated case percentage was higher for first 2 weeks, I believe, except 70 to 79 years old age group. So what does it tell us? It tells us that the vaccine in the first dose, first few weeks, was not effective. And then I think 3 weeks later, the second dose, people started getting second dose. Uh, so at that time, what we knew from those studies is that we were told that the vaccine was two-dose series. So the first dose will not provide enough immunity. We need the second dose, then it will provide the immunity. So that's why we didn't count the vaccinated people who are being sick when they are in the first dose. And then when it started getting the second dose, and fortunately we see that the COVID cases among vaccinated people dropped significantly. And you see here, this is the COVID cases. The red one is for the vaccinated cases, and the yellow one is the unvaccinated COVID cases. So if you look at until this point, everyone is happy. Vaccine works great because it's a two-dose series, and after two dose, vaccine works nice. But around this time period, you see the cases going up again, and vaccinated case percentage and vaccinated population percentage are almost the same. In some age group, it actually crossed the vaccinated percentage. So that means if I'm not allowed to say that vaccinated people are getting more sick compared to the unvaxxed people, especially certain age group, at least I can say that vaccine was not effective at that time. And actually, our scientists will agree with that, and that was it was saying at the time that vaccine has a waning immunity. So vaccine is not working anymore. We need now third dose, and so on. This is how things unfolded, and you see we couldn't prevent a new SARS. SARS emerges, and then again we see that time when vaccine works great, vaccinated case percentage is low. And then again we see the same phenomenon, another SARS comes in, and we termed it as an waning immunity. So the way I'm explaining and the way we are told is different, in a sense that I'm saying here that vaccine was ineffective at a certain time when a case was developed, when something was creating a lot of cases, and that the something is I refer as the virus favorable weather. But again, I'm not talking about those issues. But you can think about as that in a certain when cases are going up, vaccine is not really working. But our scientists are telling that vaccine has a waning immunity, and when it becomes waning, it's not working anymore. You need another dose to prevent from getting from COVID. And I'll in more slides forward, you will see that this is not the case. Rather, in a certain time, no matter how many doses you have, you still get, I mean, especially this happened after vaccination, like first to second waves. Perhaps now we have a kind of immunity, natural immunity and vaccine immunity, and this effect minimized quite a lot. But first few waves after vaccination, this effect is very easy to see. I hope I was able to explain this plot. I think this plot is very important to understand. If you do not understand this plot yet, please give it a pause and look at it carefully. Then you should be able to see. I also talk about other vaccine doses like second dose and third dose. If you go to this link here, and I explain this whole thing in a blog format, so you can read that and I hope you will understand this phenomenon very well. So this is the Israel COVID cases. So this is the very starting of the pandemic, and you see the first few waves, and this is the time when vaccination campaign started. And you see after vaccination the COVID waves is higher than the before vaccination, and you see here it almost went to zero. I was following at the time, and people are really happy that vaccine was working great and so on. Everything is open at the time here. Nobody is. There are instances when there are days when nobody in the Israel was COVID positive. That didn't happen from the beginning of the pandemic. So as I said, the vaccine was working great in these areas in this time, but then again, in a certain time when case goes up, vaccine was not providing enough protection. That's my main point. This is from another study. This supports the same thing that I'm talking here. I took this data from this article. You can go through this article and you will find this table here. This is from University of California, San Diego Hospital health workers. Again, you can see this is the fully vaccinated number 14,470, and this is the unvaccinated number 3230. So hugely vaccinated community here, and you see the number of COVID cases 3435 compared to the unvaccinated workers 11, 17, 10, 30. So obviously it's much higher, much lower among the vaccinated cases compared to that. So this is the ideal scenario how vaccine should work, and you can see the attack rate, how differ they are. But suddenly something changes. You see from 5 to 94. So this is 18 times higher compared to 10 to 31, to 3 times higher. So certainly some people started getting the vaccine way higher than the other. And you see the same phenomenon. But our scientists saying that this is because of the waning immunity, vaccine waning immunity. So you need a third dose. That's how things move on. But nobody paid attention that perhaps a certain time when cases are rising, vaccinated people actually are driving the cases. You see the rate, how rate changes so fast. And obviously, if you look at the previous data, in the previous table, the number of cases, like the waves, is higher. And this is true almost everywhere in the world. Australia was doing very good, but the waves went so high after vaccination. South Korea was doing great with the mask and other measures, and then it went high, exceptionally high. So in all these cases, after vaccination program, you will see at a certain time, it didn't start when you started vaccination. It started when the time arrived, when the perfect weather came in and the cases goes up. This is another study from Singapore, and this is also a very good study considering the number of the people in this study. 94% of the people are vaccinated, so it's extremely high vaccinated community. So this is the characteristic of the patient in their healthcare system. If you go through this article, you'll see they're actually telling something else, but I figure out the information I'll be saying right now. So again, this data is documented 1 September 30 November when the Delta wave was really happening. Like so Delta first appear in this, from this article I found that Delta first appeared in April, but it didn't show perhaps until like September. So September and November is the time when cases were really high. So at that time, what was happening? We can see here. You can see that this is the case weighted number of cases, COVID cases. So in that hospital, in that healthcare system, people were admitted, say, for respiratory illnesses. So they were tested. If they were tested negative, they termed as negative COVID cases. If they are tested positive, they termed as COVID cases. So negative cases is a kind of control. So if really vaccine would work, we would expect that, say for example, boosted or fully vaccinated, they would get the virus relatively lower rate. So the vaccine percentage would be higher in the control, the patient percentage would be higher in the control if vaccine would work better. So these are the boosted community. Boosted means they got boosted recently, because that's what we got from the article, and it is from the Delta. So during that time, there is no way we can say that those who are boosted are waned, because we didn't have passed that time period yet, 2 months or 3 months, maybe not. So they just got the booster shot recently. And you can see that in the case percentage, it is 18%. In the control, it is 17.6%. And unvaccinated is 6.8% and 6.83%. Clearly, boosted people have got more virus than the unvaccinated people, and it is already weighted. So they consider age and all other confounding factors. So again, the same thing. During a certain time, no matter how many doses you have, people are getting sick, and you couldn't avoid these the waves. And my understanding is that most likely it is driven by the vaccinated people. The cases, because the case load is super high, especially in Omicron wave. You can see here in Delta, and I'll show you more in, especially it happened in 2022, post Omicron as well. Yeah, this is one of the data that's really interesting. So you can see here the blue dot and the yellow dot. This dot represents county COVID cases, US county COVID cases. I took only the metro areas, US metro areas, because it has a lot of population, and if I normalize it 100K, the data would represent very good. So you can see the more you vaccinated, the more COVID cases you see in those counties. This is really, I mean, it's very self-explanatory, and there is no other. This is not just simple correlation, because I plot the same counties in a time when vaccine was not available, like June 8, 2022. What I did here is that I took a time, as I said, vaccine was not working during a SARS, or when a SARS was just developing, just started. So I took that week. So May 1925 was just the starting of the Delta wave. Sorry, not the Delta, the Omicron. I think this is the summer SARS. Maybe Omicron has a different version at the time. And also 2/8 is the June when the when the summer wave in 2020 was just kicking in. And you can clearly see that the areas which is more vaccinated have got more COVID cases. Now the COVID is really very severe disease. That's how I consider. So if you spread the COVID, this is a serious issue. I don't understand why this phenomenon has not been talked widely, because there are people, say the unvaccinated people, they might get the COVID, right, and they can be sick. Your argument could be then they should be get vaccinated, but again, if the vaccine would reduce the excess mortality or reduce the COVID cases, and there is also long COVID things here, then I could agree. But if there is a better alternative than a vaccine, then you have to agree that vaccine plays a role in excess mortality. If you believe that excess mortality was driven by COVID, then you also have to consider that excess mortality was driven by the vaccine as well, because vaccine is driving all these COVID cases. This is a Cleveland study, Cleveland Clinic study. I think many of you have already seen this plot. The more COVID doses, the more like infection incidence with the passage of time. Now, this is not an age adjustment, and I understand that perhaps those are the more riskier group, so they are getting more COVID. But again, if you vaccinate people and if that does not reduce the infection rate, then it doesn't make sense, right? At least you have to admit that if you do not agree that vaccine is not spreading the virus, at least you have to agree that vaccine helps. Vaccine did not provide protection during that time. And also this time is important here. You see the 12th September 2022. So they somehow they took the time when vaccine was really not working, and it corroborates what I have shown previously. Now, I want to refute another thing here is that this is also important, that the way we are told about the waning immunity and you have to get more doses to boost your immune system and to get rid of the COVID. This is not true, rather something else is playing a role here. Like as I said, the weather, nobody knows the dynamics. That's why I'm not interested to talk about this, and people will not believe it. I have underlying reason why I'm saying this, but that's another story. But here I'm pointing is that there are some studies that took they consider about the time of vaccination in day or night. So this plot shows that, say if you get vaccination during the day, say 12 or 11 or 13 hour, 11 to 13 a.m., or if you get vaccination like later, like in the evening or maybe in the night, what is the difference in hazard ratio or the vaccine effectiveness? So this data says that if you get vaccinated during the day, like in the morning, the vaccine effectiveness is higher compared to the night, and they term this as the biological rhythms in COVID-19 vaccine effectiveness. It's definitely not the waning thing. If you say that if you take vaccine in the morning it works, but if you take vaccine in the night, then vaccine is already waned, maybe during the vial. I don't know how to explain, but it's hilarious, right? I mean, you cannot say like that. You do not have definitive proof. It is definitely, this phenomenon is not the waning. This is the same pattern if you consider the year. There are times when vaccine effectiveness is higher. There are times when vaccine effectiveness is very low. And that is the time when we see the surge. That's what I wanted to show here. And this is also, I do not agree with the biological rhythm things. Rather, I would say that the air we inhale during the day and the night in certain weather condition, the humidity temperature is different, especially in indoor. I have a lot of things to say, but again, I don't want to spend time on it. So far, I believe you are convinced that vaccine is not working accordingly during the surge when there is a virus favorable weather. So now we can compare wave previous time and before vaccination and wave after vaccination, and we can consider a same territory because the weather effects in the same season would be very similar. For example, Florida, we can take the COVID scenario before vaccination, like the summer cases in 2020, and after vaccination, summer cases in 2021. And Florida in 2021, before summer cases, summer death started, almost 50, I think more than 50% were vaccinated. So after around 50% people are vaccinated, we should expect that COVID death rate or overall mortality should be lower compared to the previous waves. The reason is twofold here. One is the vaccine induced immunity and also the natural immunity, because previous year in summer and also in winter in 2020, 2021, people got the virus. So there are a lot of people who are already infected. That's why we would expect lower mortality rate. But this is very surprising. You see that I just counted number of deaths during the death waves. This plot represents the weekly excess death, and I also counted all the deaths during these death waves. And you see number of COVID deaths in 2021 summer is way higher than number of COVID deaths. Number of death in 2020. I think this is the excess death. Yeah. Number of excess death in 2021 is way higher than number of excess death in 2020. So I again looked at all those southern states, because the delta wave, the delta is not the concern. The concern is the certain weather, because in United States the weather pattern is different. The southern state and the northern state, everywhere delta was predominating at that time, but the northern states vaccine was effective in reducing COVID cases and excess death, but in southern state vaccine was driving COVID cases and excess death. So that's why you cannot consider the delta as the factor here. You have to consider the wave caused by vaccination. That's what I'm discussing here. Now let's consider that vaccine was COVID is concerning in the southern states because vaccine was not working at the time. And what is happening, the excess death in the nearby states like Florida, Louisiana, Mississippi, Georgia, Alabama. And you see in all this 2021, the excess death during a surge is way higher. You see 3,844, 5,000. So all this is higher. And interestingly, you see that the more vaccine doses was given, the more excess death, like 56% vaccinated people in Florida, 75% excess death. And the lowest was 38% here in this table, and this is the lowest excess death here. So it's very correlating. The more you vaccinated during a surge, the more you expect excess death. And the same thing when there was no SARS. I took the same like Delta season, but there was no SARS. So I compared a time when there was no SARS in previous time and before vaccination, like in 2020, when there was no COVID SARS, and another time when there was no COVID SARS, the excess death actually lower. So when we see there is no SARS, vaccine helps. But when we actually needed the vaccine, vaccine does not help, and more, and rather it helps driving cases and perhaps excess mortality. Now, if you look at individual number of deaths, it could be possible that, I'm not sure, but probably it could be possible that unvaccinated death is higher than vaccinated death in Florida. But those unvaccinated deaths are caused by what? I would blame the vaccination, because vaccination drives these COVID cases. I don't know how you conclude, but this is how I can see here. So why we know differently? Why all we know that vaccine was helping, and it reduced millions of deaths. I mean, it saved millions of lives. This kind of things. What's the issue here? I found two things here. The first is they consider the variant sometimes, like the vaccine effectiveness studies conducted by, say, variants or a time frame. Say it started from January to, say, December. If you start like this, there are waves when vaccine works and there are time when vaccine does not work. So you cannot consider like that. You have to take a certain window when there is a surge. Now find the effectiveness. Yeah, maybe you will say that, yeah, vaccine is not effective anymore, so that's why you need the third dose because it's so waning. I don't know what I would say in that argument. And another thing I found that interesting is that person year is the denominator. When you did that, you are creating ambiguous number in the denominator to calculate the vaccine effectiveness. And I argued this point here in this article, and I think this is really a serious thing. For example, if you started counting, say, from January as the time of your person year calculation, and if you consider starting from, say, December of the previous year, you will get a different vaccine effectiveness. And this is totally nonsensical, right? The changing the time frame should not change the vaccine effectiveness. And it can happen. It is possible because the infection rate is a function of time. And as far as I know, no study considered time as the potential covariant. So many of these studies actually are very ambiguous and also not correct. So if we revisit those studies, considering that the time is an important covariant, we would be able to see what actually happened. Here, I wanted to show a tweet from Professor David Dowdy. I think he pointed very important issue here that I already showed. That he said that the Delta predominant in Poland in this time. During that time, already Delta wave was spiking in UK and in USA. So his question was, why then Poland doesn't have the wave yet? The answer to this question from me is that Poland did not have that virus favorable weather yet, so it had to wait a couple of, I think, months or weeks to get the next wave. So it's not about the variant thing alone. That's what I wanted to point out here. Now, I wanted to talk about the mask here, because I think this talk is incomplete if I do not show an alternative, because COVID is a serious thing. Vaccine is bad if we have a better alternative. If you did not have any better alternative, then perhaps vaccine is maybe considered, maybe it's kind of like it's really a debatable zone. But if there is a better alternative, you will surely say that vaccine was doing harm to us. That's what I wanted to point here, that mask and or face shield was really good alternative unless you get a much better vaccine effort. So here I'm showing that if you go to this study says that if you wear mask, like they created two human simulator, and they created virus, and they sealed N95 masks. You can see here, were not able to completely block the transmission of virus droplets, aerosols, even when completely sealed. So there was a receiver, they sealed with tape. I think nobody wear N95 mask like that. So they sealed N95 in the face, and there was a receiver, and they collected samples and the culture cell, and they found that there is a detectable virus in the receiver end. So the point I wanted to make here is that mask actually did not provide any protection from blocking the virus sufficiently. Still you get the virus. So the mask did not, so my argument here is that mask did not prevent virus from entering into your body. So when you are meeting people with wearing masks, if someone is sick, you will definitely get the virus too, no matter what kind of mask you wear. That's my point here. And also, some people want to point here is that the virus load matters. So mask prevents to get more virus, and maybe you can get few virus, and that will not make you sick. But perhaps this is not true, because this study tells that viral load did not show any difference across age and appears to be a poor predictor of disease outcomes, SARS-CoV-2. Poor outcome, yeah. So that this study, if you go through this article, you'll see that the people who admitted during the time, their PCR was the COVID was counted through PCR tests, and the disease outcome and that number did not correlate very well. So it's very common sense, right? If you get the virus and body has the machinery to replicate, if there is a favorable condition to replicate or multiply in millions, one single virus in a favorable condition can make millions of copies within few days and can make you sick. So mask provides protection a different way. Again, I'm not going to talk about how, but I don't think people does believe, especially in the community, in the medical science and epidemiology. They like data. I'll show the data why mask helps, but I mean how mask helps. But I'm not interested. I'm kind of less motivated to talk about why. But in simple term, as weather plays a role here, mask helps to make the inhaling air, change the inhaling air temperature and humidity. So it makes it warm, your nasal airway becomes warm, and that helps. This is the way you help. So you get the virus, but you are not getting sick. So you remain asymptomatic. There is another study. Interestingly, this study was retracted from the journal because of widespread criticism. They took 4 patients and they used surgical mask and I think cloth mask, and they found that you can go through these lines and you can go through this article. They found that mask cannot block virus sufficiently. Still, it's transmitting virus. But that at that time when it published in 2020, that was really there was a very widespread criticism, and the editor had to retract the article. But this was a good study to show that masks cannot block virus sufficiently. And also I wanted to point another study from here in this article, an outbreak of common cold at an Antarctic base after 17 weeks of complete isolation. So the Antarctic was at the time was considered as the area where there is no virus infection. But there is one incidence, it happened, and the virus spread after complete isolation of 17 weeks. So the point I wanted to make here is that somebody in that group was carrying a dormant virus, and in a favorable condition, in unfavorable weather condition outside, they had to stay inside in the hut, and that created in a small area, many people stayed there. That created a virus favorable weather, and that virus started replicating in the body and then spread to other people. So the point I wanted to make here is that this study also tells that dose may not matter. In a right condition, a small amount of virus can explode. And here, this is I took the article from the early stage, and you see that there are a lot of people. This is the two outbreak, and in this two outbreak, mostly are asymptomatic. Like 95% of people are asymptomatic, 95% of people are asymptomatic. In this Oregon seafood processing plant and Tyson checking processing plant, because these people are wearing masks. So mask couldn't prevent infection, spreading infection, but it could make people asymptomatic, and this is how we would get the natural immunity much faster, and yeah, the death rate, everything would be severely low. That's what I wanted to show here. Here, another thing is the face shield. The face shield is not widely discussed. The reason is that we believe that mask provides protection by blocking the virus. The face shield obviously cannot block the virus because the airborne particle, it doesn't make sense that face shield can help, right? But face shield actually can also provide some uh, good like non-virus favorable environment, the inhaling air properties, because you are exhaling air the same way how the mask works. The face shield also provides protection by creating non-virus favorable air properties. So air becomes hot and humid within these face shield areas, and you are inhaling, your nasal area do not get cold, and you'll get a better protection. Here the two example, again you can go to this article, you see after intervention how much it helped. It was, this is for the ACP, means the, I think, healthcare worker, and this is the cases from hospital acquired infection. So this is from the patient, and patient were not told to wear face shield. So you see there is no the sudden drop in the cases. Yes, somewhat drop, and the great thing you see is the community infection in the Houston area. And after intervention, the number of cases had dropped significantly. And here you can also, this is from India, and you see after adding cases, after adding the face shield, number of COVID cases dropped significantly. So before face shield, 62 workers, 40 women visited 5880 homes with 31,000 persons. From this, 2,222 persons tested positive for SARS-CoV-2 May 4 to May 13. 12 workers are infected. So after that, I think rest of the month, they use the face shield, and you see the 4 developed. Okay, now 50 workers. Now the 50 workers continue to provide counseling, visiting 18,000. So much higher, like I think 3 times higher homes, and counseled much higher number of people. And also they countered like many more COVID cases, 2,600, this amount of positive COVID cases. And interestingly, no worker developed COVID symptoms after implementing this face shield. So I hope I could show more robust studies, but these 2 studies are, I believe, sufficient to say that mask and face shield would be much better alternative. And yeah, throughout the pandemic, I tweeted a lot, and I predicted many times that something is going to happen, and exactly that happened. For example, this tweet, I observed the weather situation in, for example, in New York at the time, and this was the wet bulb temperature. This is the virus favorable zone. When I saw that this the weather becomes relatively warm in the area and it is away from the virus favorable zone, I noticed that there is a drop in COVID cases. So COVID cases did not grow. And when I saw this weather again in this virus favorable zone, and I predicted that the COVID cases will grow soon, and that happened during that time. And this is from another study. I forgot to mention the citation here. This is from Oklahoma, a gymnastics study. I'll provide a link in the description below in the video. So this is the symptom onset date, and this is the number of COVID cases. And you can see this dot, the yellow dot, not yellow, I think the brown dot represents the COVID cases. And I also took the weather of the indoor weather in those areas. So for example, here you see the COVID cases is 0, and you see this is a very striking correlation why COVID cases is 0 in these days. So I just shifted these 2 data 2 days, because from studies we have seen that it takes roughly 2 days to develop a symptom. So when I got the virus, and today is the virus favorable weather, perhaps tomorrow, the day after tomorrow, I'll be more sick, or I'll show the symptom will onset in 2 days. That's why I had to shift the weather in 2 days to match what's happening here. And you see, these 4 days, the number of symptom is 0, because the indoor wet bulb temperature was higher. And when indoor wet bulb temperature was the virus favorable, for example, near 14 degrees Celsius, you see higher COVID cases, or near 13 degrees Celsius, it's a wet bulb temperature, COVID cases is higher, this one. And when it's constant, the weather, constant virus favorable weather for the day or for several days, that is the more concerning. When it changes day and night, maybe it's in non-virus favorable and then virus favorable, most likely people are not being sick that much. But if it is continuously in virus favorable zone, we can expect more COVID cases. For example, this one, you see these are the constant temperature in the virus favorable zone, like 12, 13, 14 degrees Celsius. So this is a very nice correlation to show that how people are being infected, being sick due to virus favorable weather.